red blood cell, 4.8 to 5.4 million per drop, per microliter, okay? A milliliter is about 20 drops, so 1 or 2 drops. And then all the rest of these, 5,000 to 10,000 in that same drop. So there's going to be a lot of these, which is good because now you get to compare sizes, okay? Like that's almost the same. That's about 3 or 4 times the size. That's about 2 or 3, that's about 3, that's about 2 or 3. Okay? So you have the size as a means of comparison. This is a lymphocyte, he says without even looking. Single round nucleus pretty much fills up the whole cell. This is a small lymphocyte. This is a large lymphocyte. Same color nucleus, slightly C-shaped. This is a monocyte. Its job is to escape the blood and become a macrophage. Biggest of all the cells. And a C-shaped nucleus, but stains lighter. So you definitely need to compare size when trying to determine that. So these are the agranulocytes, without granules. Now we have the granulocytes. Neutrophil, eosinophil, basophil, without even looking, okay? Now, they're not even going to stain that much. It's going to be hard to see the granules. Okay? The way you're going to do it is you're going to use fine focus and see if granules start appearing around the edge. These are going to be the most numerous. And these are multi-lobed. Okay? 4 or 5 lobes for sure. 3 lobes. Okay, eosinophil. Stained orange. Basophil, stained blue. Okay? And this has a barbell shape. 2 lobes. And the barbell has sag. Okay? There may be so many blue granules, you can't see how many there are. You can't see the nucleus. So you may want to confuse this with this. Look at the size difference. This is what's called a platelet plug. It consists of individual platelets and strands of fibrin, activated fibrinogen. Okay? So this is the second phase. The first phase is vascular, the second phase is platelet, the third phase is coagulation. Some professors will say that this is showing hemoglobin. I say that this is a reticulocyte in the act of shedding its nucleus. Okay? Do you see them in a normal blood smear? Yes. if you see an uncommonly large amount, there's a bleed somewhere. And it's usually an unrecognized bleed, because if you were bleeding, you'd stop the bleeding. Okay? So it's internal somewhere. So if you see an abnormally large amount, reticulocytosis, and there's a bleed going on somewhere. Acute viral. Okay? Acute bacterial, chronic viral. Parasites and allergies. Eosinophil. Okay? Histamine and heparin. Okay? 60-30 A30, never let my engine blow. Okay? 60, neutrophil. 30, never, neutrophil. Wait a minute. 60, neutrophil. 30, 60-30 A30, never let.
No lymphocyte.
So it's a lymphocyte, right? 8, never let my monocyte. Engine, eosinophil. 0, blow, basophil. Okay? $4.8 to $5.4 million for a drop or two per microliter. 5 to 10,000 total. Okay? And again, if you see an increase in the percentages, and the numbers I give are roughly in the middle of the range, if you see an increase in the percentages, then the cell has been called upon to do what it does. Okay? Release histamine and heparin. Okay? Cause inflammation. Okay? Neutrophil. Right? Reduce inflammation, in addition to neutralizing bacteria. Now, the monocyte, the neutrophil, and the eosinophil are phagocytes, meaning they will eat cells. We're going to learn at the next lecture. They will also seek out lymphocytes and display pieces of what they've destroyed on their cell surface to the lymphocyte, so that the lymphocyte can produce specific immunity, antibodies specific to that pathogen. Okay? All right, go learn them, then we're going to talk about the board. Then we're going to pull out the microscopes.